We're really focusing today on first breath and tobacco cessation specifically, so that's what we will be referring to today's conversation through. I know Lauren's getting my slides ready, which is perfect. So we want to again just say thank you for your commitment to the continuing education, because we really know that that's showing your support for the women that you serve through First Breath programming. Today we have a very exciting day in front of us and a very full agenda. You do have an agenda in the binders that you would have gotten at registration. And we're going to be exploring difficult conversations, how to get through them, and why they are important. Tobacco use and cessation are very personal aspects of someone's life. And when we're having conversations surrounding one's cessation goals, we know that many other difficult topics are going to be coming up. So our goal for today is to assist you in navigating this dialogue in a positive and effective way. And we're honored to have you all here with us. So if Lauren wants to grab my clicker, or as my one of our speakers today indicated, this is a slide forwarder. No, what did you say? Slide advancer. I was like, oh, we call it a clicker. We're really technical. All right, so this morning I'm just going to start us off by providing a brief overview of the Foundation's programming. Then we're going to spend some time recognizing everyone in this room, and finally get into a deeper look of what's happened in First Breath in 2018. And you guys are going to get to meet the quick coaches that are assisting all of your participants. The Wisconsin Women's Health Foundation is a nonprofit organization that provides health services and education for women and families. Our mission is to innovate, impact, and improve women's health. How many of you guys recognize the woman on this slide? Miss Sue Ann Thompson. She's our president and founder, and has been with the foundation since it began. What we do at the foundation is provide free women's health education and support programs for women and their families throughout Wisconsin, and we also administer funds for women's health research initiatives. Grapevine is a program of the Wisconsin Women's Health Foundation that trains nurses to lead health education sessions in their communities. Nurses are completing annual trainings on Wisconsin Women's Health Foundation curricula, which is developed with input from academic partners and written by the lovely Danny, who is taking photos right now. They then use these toolkits to provide free 1-hour education sessions on women's health topics. And the goal is to educate Wisconsin women about disease prevention and healthy lifestyle changes. I think we can all in this room get behind something like that. We actually have a few Grapevine nurses in the room with us today, if you wouldn't mind just waving. The first is Deb Wagner from Calumet County. Awesome, thank you, Deb. We have Mary Kosterman from South Milwaukee Health Department. There's Mary, and Melissa Resnick-Killian. All right, so if you guys have questions, oh, did I miss anybody? Anybody that was on this? Okay. If you guys have questions about Grapevine, if you want to learn how to get involved, I'm sure those three would be willing to share their stories. Otherwise, you can contact myself or Danny or anyone at the foundation if you're interested in getting involved in some more community outreach. I know one person's already reached out to me this morning, so it's a great experience. We also have the Susan G. Komen Breast Cancer Assistance Fund, which provides financial assistance for both men and women in need of breast health services. The Wisconsin Women's Health Foundation administers these funds from Susan G. Komen, Wisconsin, which allows over 400 individuals per year to receive these breast health services. The Susan G. Komen Breast Cancer Assistance Fund can help individuals who are income eligible and live in 22 select counties in Wisconsin, which is considered statewide for this fund. This financial assistance is really vital for that early detection of breast cancer and in making recommended services accessible. We also have My Baby and Me. Raise your hand if you've heard of this one before. All right. My Baby and Me helps women achieve alcohol-free pregnancies through screenings, education, phone counseling, and text message support. We have over 2,000 pregnant women who are screened annually by 90 providers and sites throughout the state. So many of you in this room, these healthcare providers, use the My Baby and Me screening process to identify pregnant women with alcohol-related questions or concerns and a history of alcohol use. Women who then need additional support are referred to our foundation for phone counseling and education through our health educator, pregnancy educator, Rebecca. And the My Baby and Me, really what it's doing is it's providing that consistent messaging and evidence-based information about a very often confusing issue of alcohol use during pregnancy. But today, we're going to be focusing our time on First Breath specifically. As you know, First Breath is a free program that helps pregnant and postpartum women and their families, more on that later, quit smoking. And First Breath services are now available statewide. What we do want to make sure happens is thank our funders. We want to thank them for supporting this work and truly allowing us to have today's First Breath Tobacco Cessation Conference. Our programming is primarily supported through the generous funding from the Wisconsin Department of Health Services, but our project is also funded by the UW School of Medicine and Public Health from the Wisconsin Partnership Program, as well as SSM Health. So again, we need to say thank you very much for all of the support that our funders are providing. Before we dig into First Breath programming, I want to take a moment and pause in what I feel has become a bit of an annual tradition where we value our time together and we recognize those individuals in this room, because we'd really be remiss to pass up an opportunity to recognize why the First Breath program is successful, and it's all of you. It really would not be what it is today if we didn't have such dedicated and committed partners like those of you in this room. Your professionalism, your dedication to family health is critical to the success that women have in quitting smoking during their pregnancy and then continuing this postpartum. So, we're happy to say that our program's reach continues to grow. And at this time, I'd like to introduce the newest sites into the First Breath provider family who are here with us today. So, could you please stand if you are from Children's Hospital of Wisconsin Community Services, from Divine Savior Healthcare, and from King Lee Community Resource Center. Wonderful. Thank you guys for joining us. Don't worry, you're not the only ones that have to stand. Everyone in the room will. But we really do want to just say thank you, welcome, congratulations on becoming a First Breath site, and we hope that you enjoyed today's conference. Okay, next we want to give a shout out to all of our sites who are continuing their work in First Breath. So we will ask that you please stand when you see your name listed on the screen. I'm not going to say all of them because there are several, but please stand if your organization's name is on the screen, and let's give a round of applause to these sites who have served our women in our program for up to 5 years. Thank you. All right, if your site has been involved in our program for between 6 and 10 years, please stand up and we would love to thank you. And last but not least, look at this list. Okay? If your organization has been involved in our program for more than 10 years, we invite you to stand. Thank you guys so much. I mean, it's honestly a remarkable thing to be part of this program and to have partners like all of you who have truly been dedicated to this for more than 10 years. Even those of you who have been in for 6 to 10, for up to 5, who are new, it is just heartwarming to know that you're all here today to continue your education and to help the moms you serve. So thank you. 2018 has brought about some very exciting developments to our First Breath programming, our new Ask, Advise, Refer model. The model changes we've implemented are those to meet the needs of our community, which really bears the question, why do we need to continue to talk about tobacco? Why does this need to be a focus in our communities? And according to data from the Wisconsin Department of Health Services, approximately 1 in 9 pregnant women in Wisconsin are using tobacco during their pregnancy. While we have made great strides in reducing the impact of tobacco, this progress has not been felt consistently across the state. And this map highlights some of these disparities. As you can see, there are still communities and regions who are bearing a disproportionate burden of the tobacco addiction. And in several counties throughout Wisconsin in 2016, more than 1 in 4 women were smoking during their pregnancies. Oh, excuse me. All right. In addition to geographic disparities in maternal smoking rates, there are other income and education-related disparities as well. 1 in 5 women on Medicaid are smoking during pregnancy, and among women with a high school diploma or less, the same ratio is true. Among other trends, 1 in 5 women who identify as biracial or multiracial use tobacco during their pregnancy, and 1 in 3 Native American women use tobacco during pregnancy. Also, almost 1 in 2 pregnant women who live with another smoker are using tobacco during their pregnancy as well. And we're going to be talking a lot more about that this afternoon with Dr. Piper on social networks and a panel facilitated by our very own Chrissy Alanese on the influence of family and cessation, because we know that when you have those around you who are smoking, it does have an effect on that mom's ability to make positive behavior change. And another challenge that we're seeing is the rise in other tobacco products, such as e-cigarettes and snus and smokeless tobacco. So we do have some challenges. The other tobacco products are especially on the rise among youth and young adults, and we know that that's partially because tobacco companies are doing a heck of a good job developing products that target this population, including the flavorings and direct marketings. In November, how many of you guys were able to tune into our webinar? Awesome, I saw some hands go up. We held a webinar with Spencer Straub from the Wisconsin Tobacco Prevention and Control Program, and he provided an overview of the new Tobacco is Changing campaign, which focuses on raising parent awareness of these new flavored tobacco products and their popularity with young people. But with challenges, we know there's good news too. Our state is making progress in smoke-free air laws, and public housing is going smoke-free as of July 31st, 2018. So if you didn't know that, that's a huge step for anyone who lives in public housing. Another development, which we're going to be focusing on today, are the updates made to our First Breath programming, our new expanded, streamlined First Breath model. And through these updates, we can help more women, we can provide intensive, quick coaching in every county in the state, and we can assist family members. So let's talk more about the model. First, I would love you guys to just raise your hand if you've completed the training in our new Ask Advisor for model. That is awesome. We would love to see all of the hands go up, and if you didn't raise your hand, please feel free to talk to Lauren today. She'd be happy to get you all set up. And we really want to say thank you to those of you who have completed the training and have helped us and assisted us in getting this new model off and running in 2018. Updated First Breath allows providers to offer smoking cessation services through a three-part approach: asking about tobacco use, advising that the best thing they can do for their health and their family's health is to quit, and then 3 is referring. And it's referring those interested individuals for additional cessation and support to the Wisconsin Women's Health Foundation. We do want to say thank you for all of your feedback and your assistance in supporting the transition to the new model. I know that change can sometimes be really hard to embrace. Believe me, I came back from maternity leave and voila, it was a new program, which I was super excited about, but it was a change. And so we want to say thank you. This change did not just come about, over one night. It was the process of annual provider surveys, focus groups, and pilot models that made it all happen. And many of you in this room were invested in that, so thank you. And the implementation of this did begin January 1st of this year. And there's really 3 main updates that I want to highlight. So due to the nature of the new model, training is now completed solely online, and it's all at your convenience. We know you're going to miss our trips, but we will still be coming to visit you guys, so don't worry about that. But we're saving time that way. And another way we're saving time is through the use of a 1-page referral form. We want to make this convenient for you guys. We want to make it easy. So after completing and submitting those forms, referred participants are being connected with our Wisconsin Women's Health Foundation Quick Coaches, and then they're continuing their cessation services through that. This image should look familiar to everyone in the room, and it outlines the model in more detail. It highlights the First Breath site, that's all of you in the blue, and the relationship that you have with the moms. And then the Wisconsin Women's Health Foundation Quick Coaching staff, that's us in the yellow. And this image is part of the material that we cover in that online training, and we invite you to reference it as you continue to get comfortable with the new flowchart and comfortable with the new model. We know you guys are already using the new system and you're familiar with this form, but I really just want to take a moment to celebrate how short it is. I don't know about you, but about 6 years ago, I recall the enrollment form or enrollment survey being 4 pages long, just the enrollment survey. And now we have everything combined on one form. You complete that, you submit it to us using our online data entry system, which is shown on the right, or by fax or mail on the left. And remember, too, that these forms are specific to each provider. That is different from what we've experienced in the past. And as you complete our online training, you have access to download paper copies of the referral form that have your specific provider information already pre-printed. So we'll actually say your name and your information, so we know that that referral is coming from you versus just your organization in general. If you do want more paper copies, just submit a material order form through our webpage within that provider portal, and we'd be happy to get those. And then for those of you submitting data online, you're seeing a drop-down option which comes up with a list of all of the current sites and providers. So again, you can choose your name specifically there, and we know that the referral is coming from you. This just helps us with tracking. It helps us know all of the training completions that have come through, and really allows us to have more effective follow-up with all of you as well. So on that note, it is important for each provider to complete the online training with our new Ask, Advise, Refer model individually. So if you or your colleagues haven't completed it, it's certainly not too late. We welcome you to do it tomorrow if you want to. But as soon as you're able, the online training can be completed independently using the link provided on the screen, which is www.providefirstbreath.org. It takes approximately 30 minutes to complete and is comprised of 3 parts. So you'll do a pre-training survey, you'll watch the First Breath training video, and then you'll complete a post-training. And after you complete all 3 parts, you're going to receive an email from our Training and Technical Assistance Coordinator, Lauren, and receipt of that email is the confirmation that you've completed the training in full. And then we'll give you all the material that you need to start First Breath referral services. Does that make sense to everybody? Okay, and again, thank you to everyone who's completed this. I know this is a little bit of just the policies and procedures and the not so fun stuff, but we just want to make sure everyone's up to date. A few more reminders just moving forward with the new model. First, we encourage you to ask everyone every time, or as one of our providers says, always ask, always offer. First Breath is now able to assist not only pregnant women, but also postpartum women, significant others, and family members, caregivers. I mean, really anyone who's caring for children or has young children, they are welcome to join First Breath. And this expansion is very exciting. We just want to make sure that everyone can benefit from our amazing Quick Coaches. So please just make sure that if you have anyone who has exposure to tobacco, they're being involved in the First Breath programming. Second reminder, we ask that you guys explain the referral process and what your participant can expect for next steps. Explaining this referral familiarizes the participant with what's to come, and we know that every participant can expect a phone call from their Quick Coach within 1 week of the foundation receiving that referral submission from you. So they will hear from us within 1 week of us knowing that they've been referred to the program. Once they're connected, the participants will be offered monthly contacts with our Quick Coach staff. This includes home visiting, it includes phone calls and text messaging. It also includes carbon monoxide breath tests so that we can monitor participant progress. And through these contacts, participants will receive that cessation counseling and support, and they'll also be able to earn gift cards. As you guys know, and many of you work with other referral programs, a warm handoff is really important to clearly explain next steps, and it's a great factor in having the success of a referral program moving forward. So please let your participants know who their Quick Coach is and when they can expect to hear from them. Which brings us to the question, who are these wonderful, amazing Wisconsin Women's Health Foundation Quick Coaches? Quick Coaches are employees of the First Breath program through the Wisconsin Women's Health Foundation, and they are each trained certified tobacco treatment specialists located throughout the state to meet the needs of participants across all Wisconsin counties. These individuals have completed specialized trainings on the unique challenges of the perinatal period and how to best assist the participants that we serve. The following map outlines the regions which our Quick Coaches cover. And as you can see, all counties throughout the entire state are covered with these new referral services. I mean, how awesome is that, right? And in order to get to know your regional Quick Coach, we asked each of them how to answer this question. What do you most enjoy about your work as a Quick Coach? And here's what they had to say. First up is Amanda. Many of you may recognize Amanda. You've met Amanda. She has been with the foundation working with our moms since 2013, but she's also been a trainer working with many of you in the northern region as well. Amanda says, I truly enjoy my role as a Quick Coach. Supporting women to make a positive change in their tobacco use is incredibly rewarding. Working with women who have overcome major barriers and obstacles to give their children and themselves a better life is inspiring to me. I admire the women that I work with. They are so strong. So that's Amanda, and you can see there outlining which counties she serves. So again, if you are working in one of those counties and you're referring moms to First Breath, that's who they'll be connecting with as a Quick Coach. Our newest member of the Foundation's Quick Coach team is Greer. Greer covers the North Central region and joined our team in 2018 through a brand new position covering this area. We're absolutely thrilled to be able to offer services in North Central Wisconsin. And when asked about what her favorite part of the position is, she said, "I enjoy working as a Quick Coach because in doing so, I witness program participants creating and working towards specific goals. Observing the sense of empowerment these women gain in making their own plan and achieving their own personal goals, often in spite of adversity, is very inspiring." The Northeast is covered by Rebecca, who has also been with our team since 2013 through First Breath, as well as My Baby and Me. And as a Quick Coach, Rebecca loves working one-on-one with moms and watching them learn new skills and make lasting changes for themselves and their families. Caitlin provides services to First Breath participants in the Southwest. Caitlin has been in our staff since 2013 and enjoys her time as a Quick Coach because, in addition to supporting pregnant and new moms on their quit smoking journey, I also really love assisting them with other aspects of their life, such as breastfeeding, and connecting them with other valuable community resources. So that's Caitlin. And due to the dense population, the Southeast region is actually covered by 2 Quick Coaches. The first is Hattie. Hattie has also been with the Foundation since 2012 and says, "I enjoy most that mothers allow me into their home in order to learn more about their root causes of smoking and assist them with creating a personalized action plan to quit." So that's Hattie. And last but not least, the other Quick Coach that's assisting First Breath participants in the Southeast region is Felicia. Felicia also may be familiar to many of you as she too has provided First Breath trainings and to sites in the area. And what is it that Felicia says about her favorite part of being a Quick Coach? "I enjoy connecting with participants and working with them on developing an individualized, creative plan for quitting or cutting back on smoking." This comprises our talented team of Quick Coaches who are reaching out to your pregnant and postpartum participants. But wait, who is it that's assisting our significant others and family members and caregivers who are referred? I think this actually has to have a drum roll. Are you ready? What do you think? It's Carl! I had to do that, not only just to kind of embarrass him a little bit, but many of you guys know Carl as he was a former program coordinator, and he completed trainings with so many of you guys in this room. And we know as we travel around, people are always asking, "How's Carl? Where's Carl? What's he doing?" So Carl's still at the Foundation. He is getting his occupational therapy degree right now, but he also is doing this new role, and he's the initial contact for all the support people who are referred to us through the Ask Advise Refer model. So rest assured, your participants are in good hands. And although our Quick Coaches are doing most of the heavy lifting when it comes to evidence-based cessation services and support, we want to maintain that you are still very much involved in your participant cessation journeys. Best practice encourages that you continue to provide brief intervention through your visits with moms. However, you don't need to do forms to show us this. It's really the best of both worlds. We'll continue to provide resources through our First Breath provider portal, technical assistance, and continuing education opportunities as well. And the beauty of this new model is that your counseling involvement can be as little or as much as you want it to be. We know some of you work in a clinical setting where things are very fast-paced, and you need to make sure that you can get to the acute needs of those moms. We also know that many of you may be doing things through a home visiting program, and you have more time to talk and complete a more thorough assessment of your participant cessation goals and needs. We want to make First Breath a good fit for all situations, and the new model has given us the opportunity to take away paperwork so you can focus on conversations and supportive relationships. The following cheat sheet, it's also highlighted on the online training, is simply a guide. It allows each session to give you a breakdown of what you could say and do to support your participant cessation goals, and feel free to take what works and leave the rest, or use it all. It's, again, a guide for you. We want to make it work for you. Regardless if you have time during these visits to complete intense cessation, your relationship is important because it supports that participant and it connects them to our Quick Coaches. Our main communications about program updates, training, and continuing education opportunities are going to come to you through our monthly e-newsletter. And we know many of you receive many emails, right? Your phones are already dinging from the morning. But I promise that these monthly contacts, they include relevant and important information for your work as a first breath provider, and they're worth looking into. So if you're not already receiving them, please let us know. Also check your junk mail or your spam folder, your clutter, or whatever else they've come up with these days. But Lauren would be happy to connect you in getting these every month. And finally, for all the data buffs out there, I regret not taking the opportunity to give a brief review of the work that everyone did in 2017 to support our First Breath moms. Throughout last year, 1,222 women were served through our First Breath program. 84% of these participants were able to abstain, quit, or cut back on their tobacco use while pregnant. So once again, you truly make a difference. 500 participants also enrolled in our Text Connect Quit program to receive regular text message support through their pregnancy as well. And you'll find more on this through a copy of our 2017 annual report in your binder. I think it's on the left side there. But in short, 2017 was a great year for First Breath, and we're excited to see the impact grow with the new model. We are just getting started with our programming and are so thankful for your participation in the 2018 annual First Breath Tobacco Cessation Conference. As you enjoy today's meeting, we encourage you to take the time to connect with one another, and as well as our staff here today. As I mentioned, some job duties have changed at the foundation, so I just want to clarify, Lauren is now your primary contact for First Breath programming, and she can assist you with questions or concerns regarding training, technical assistance, participants, and she'll also be communicating with you guys electronically through those e-newsletters and quarterly check-ins. Chrissy and I are always here. I'm not going anywhere. And we can provide that additional support on management questions, but Lauren's really your go-to gal for programming needs. Again, we appreciate your attendance, and we look forward to all of the times that we can all be together to touch base in person. Please don't be a stranger. Come up and say hi. If you want to see a picture of the baby, I might be inclined to show you. I did that pretty well last year, right? But again, we just want to say thank you, welcome, and we will be moving on to our next session. So thank you, guys.